Good morning, everyone. Today we are going to explore how biomaterials give people their mobility back through joint replacements. Today I'm going to talk about an existing topic, a joint replacement in biomaterials and artificial organs. Before we begin, let me ask you something. Have you heard of hip or knee replacement surgeries? Yes, exactly. Those are some of the most common examples of joint replacements. In simple terms, joint replacements is a surgical procedure where a damaged or diseased joint is replaced with an artificial prosthetic device. These biomaterials implants restore movement, reduce pain, and greatly improve the quality of life for patients. Every year, more than 1.5 million joint replacement surgeries are performed worldwide, and the most common ones are hip and knee replacement. And these are the overview of today's lecture. And let's start with the first design thing stage, empathize. When we empathize, we try to understand the patient's pain and needs. Think about how joint disease affect a person's quality of life. They can't walk, lift, or even perform daily activities comfortably. So joint replacement is all about improving quality of life, restoring mobility, and using technical advancement and biomaterial knowledge to make that possible. I want you to imagine how it feels when someone who couldn't walk due to arthritis is finally able to move freely after surgery. That's true goal of biomaterial innovation in joint replacement. And now let's move to the defined stage. So what exactly is the joint replacement? It is the surgical procedure medically called arthroplasty, where a damaged or diseased joint is removed and replaced with an artificial implant. These implants are made from metals, ceramics, or polymers, and their function is to restore mobility, reduce pain, and improve the overall quality of life. I understand the success of any replacement depends on the right combination of material and design. For instance, using the wrong metal could cause corrosion, and using the wrong polymer might lead to a wear. So, biomedical engineer must define the patient needs clearly before designing the implant. When we go for the joint replacement, when it affects the everyday movement and it provides some pain in the joints and it is affect the normal day activities, and even though we use some medication, the pain is not reduced. That time we go for the joint replacements. There are many types of joint replacements are done. Let's look at the first major type, a total hip replacement. It is a surgical procedure to replace a damaged hip joint with an artificial implant. The main purpose is to relieve the pain and restore mobility. Common candidates are people suffering from osteoarthritis and hip fractures. The surgery involves removing the damaged femoral head and replacing with the artificial components, which can be fixed either with a cement or left and cemented to fuse naturally. The implants included the femoral stem and head. Materials used are the titanium and cobalt chromium alloys, and the ceramics are like alumina and zirconia are used. Polymers like ultra high molecular weight polyethylenes are used. And the next type is total knee replacement. This procedure replaces a damaged knee joint with an artificial implant. It's commonly performed for severe osteoarthritis. And in the surgery, the damaged cartilage and bone from the femur and tibia and sometimes the patella are removed and replaced with the artificial components. The implants used the femoral component, tibial component, and sometimes the patellar components are used. The biomaterial used are cobalt, chromium, and titanium alloys for the metals, and also polymers used, and sometimes ceramics are used for the coatings application. And not every knee needs a total replacement. Sometimes only one part of the knee is damaged. That's where unique compartmental knee replacement comes in. In this procedure, one the affected compartment, either medial or lateral, is replaced with an implant. This approach relieves pain while preserving the healthy bone and ligaments, maintaining a more natural knee function. And ideal for younger moderately affected patients where the most is knee is still. Moving upward, the next type is shoulder joint replacement, also called shoulder arthroplasty. This is done when the humeral head and a glenoid cavity are damaged due to arthritis, fracture, or degeneration. The purpose is to relieve pain and restore home mobility. The implants used include humeral head component and glenoid component. Biomaterials like titanium, cobalt, chromium alloys, and polymers and ceramics are used for this implant. And next, it is the total elbow replacement. This surgery replaces the damaged elbow joint, including parts of the humerus and ulna, and sometimes the radius. When an artificial implant, the implant uses humeral and ulnar components made of titanium or cobalt chromium alloys for strength, and sometimes polymers are used for the smooth motion. For elbow replacement, we use the implants like humeral component and ulnar component. The materials like cobalt, chromium, and titanium alloys are used, and sometimes the polymers are used, and ceramics are used for the coating applications. Finally, let's summarize why we perform joint replacements. The main purpose are pain relief, restoration and mobility improvement, and joint function correction, and overall enhancement of the patient quality of life. Choosing biomaterial for joint replacement is very important. Why? Because it lead to some risk. Sometimes it lead to a material risk, and sometimes it lead to a biological reactions like biocompatibility issues, allergic and infection, and sometimes surgical and economic challenges are also included. These are the references. And thank you. Have a great day.